Have you been told that you have gastroparesis? Gastro refers to your stomach. Paresis, you can think of like paralysis, where your stomach is not, it's not completely paralyzed, but it's moving very slowly. And there's about 7 different symptoms that I want to go over with you for what the early signs are. So the reason I wanted to do this video is that early signs of gastroparesis are best caught early, meaning that it can really worsen over time, and there are not good solutions for it from the conventional medicine model. So the sooner we who are more on the natural end of the spectrum can spot this and treat it, then we can get it resolved for the most part. And that's quite crucial, because the only medication that is approved for gastroparesis has a horrible side effect, which is called tardive dyskinesia, and that's when you don't have control of the muscles of your face, your mouth, your tongue, and there's also psychiatric drugs that cause that, but the only approved FDA drug for gastroparesis can do it as well, which is a horrible side effect. So we want to avoid that. We want to focus on what we can do naturally. So let's start with what some of the early signs are, which here at Root Cause, where we see a lot of patients with acid reflux, a lot of patients with hiatal hernia, those pretty much go together. They have these early signs, and of course our program, when it's successful, which it typically is, addresses that, but you might be putting up with these early signs and not realize that it's something you want to jump on sooner versus later. So let's go through the 7 early signs. One is early satiety, meaning you're satiated. You get full very quickly. You know, some people say just a few bites of food is all I need, and then I start to feel full. Bloating after meals, very common. It's the upper abdomen, because that's where your stomach is located. And this can last for hours. And I frequently hear the comment, the food's just sitting there. It's very uncomfortable. It's not digesting. Also, nausea after eating. This can start in a mild sense, but then it worsens over time. You have upper abdominal, in addition to the bloat, you just have a lot of discomfort and a lot of pressure. And it's that pressure, unfortunately, that can cause the hiatal hernia. It's pushing the stomach upward. And the comment I hear all the time with this is, it feels like my stomach's coming up into my throat, you know, which is pretty apt, because it's pushing up into your esophagus for sure. Now, there's also belching or reflux. So the classic acid reflux, or a lot of belching, again, due to this pressure, because the food is just sitting there. And then loss of appetite. People can start getting an aversion to food, where it's like, oh, I just don't want to eat. It just sits there. I'm so uncomfortable. And you can hardly blame them for the feeling, but obviously we have to eat to be nourished and retain our health, so we have to handle that. And lastly is fatigue after eating. Obviously food is supposed to be nourishing and give us fuel, and you feel fatigued because you're not getting nourishment. The food is literally just sitting there. It's not digesting, you're not absorbing it, and you're being malnourished as a result. Okay, so who's at risk? Those with acid reflux are at risk. Those with vagus nerve involvement, which the people with acid reflux and the people with hiatal hernia are in this category. Also post-surgery. If you've had any surgery in the upper abdomen area, they can unfortunately damage part of the vagus nerve, one of the branches of the vagus nerve, and put you at risk for this. Also, diabetics, type 1 and type 2, if you are not being managed well, are at risk for this. And then if you have a history of viral infections, autoimmune disorders, or eating disorders. So those are the people that are highest at risk. Obviously on this channel we focus a lot on gut health, a lot on acid reflux and hiatal hernia. So if you're watching this channel, you're likely potentially at risk for this. So there is, as far as conventional medicine testing, there is gastric emptying studies that they can do to literally, they watch how long it takes your stomach to empty, and so you can see if this paresis is happening. There's also a smart pill, it's called, it looks at motility, and then the classic endoscopy, which maybe you've had if you have hiatal hernia or acid reflux. So those are the tests that are done. Now let's look at the treatment. I told you the conventional medicine treatment is just to manage symptoms, and the only approved FDA drug has this potential for the terrible side effect of what's called tardive dyskinesia. Definitely a condition you want to avoid at all costs. So the good news, the good side, what we do is I identify and remove the triggers that are causing this. So the vagus nerve I mentioned can be a trigger. Having diabetes or blood sugar that's not under control, having dysbiosis, meaning the gut bacteria in your colon are housing more bad guys than good guys, so you have this imbalance of bacteria. You can also have SIBO, small intestinal bacterial overgrowth. That's very common from acid reflux and hiatal hernia. You can have a mold and or any other kind of environmental toxicity, or you can have an autoimmune disease, and these are all things that we address. So what do? We look for food sensitivities. I mean, this is all about food going into your stomach, so you want to make sure there's no food sensitivities that you have that are inflaming your gut. The vagus nerve optimization is very, very important. There's a lot of things you can do naturally to optimize your vagus nerve, from humming and box breathing to there are vagus nerve stimulators. The one we use here is called Truvaga, Truvaga. Not affiliated with the company, although we can get you a discount on it if you want. We've definitely had a lot of patients do very well with that. And then also the dysbiosis. So that's a big one. So you have this imbalance of good bacteria and bad bacteria in your gut that of course is created by the food sensitivities and the vagus nerve instability, and the fact that your blood sugar levels are unstable. All of these things go, and of course having toxins like mold or other environmental toxins, these are all feeders into creating dysbiosis. And that's where you have to have that broad look at all these things that are on your list of what to see present or absent, yay or nay, and then address this in the right order. As an example, I talked to a patient last night, actually more of a friend than a patient. She's not really a patient, but she recently had her gallbladder removed. She knows she has mold at her home, and she goes, I think it's the mold, it's the mold, it's the mold. And she also has severe, and has had, and probably the reason she lost her gallbladder, severe constipation. At this point, she's in the hospital. She can't eat, and her focus was, it's the mold, it's the mold. And I'm like, it can very well be the mold, but that's the wrong order of business. We have to get your gut working, and I say we, I mean the hospital, because that's where she is, and that is the right place for her right now. Unfortunately, she did not have a good result from her gallbladder removal surgery. But and I'm giving a very dramatic example, but let's just go to an average person who's just constipated but is not in hospital and is living life. If you try to detoxify from something like a mold or other environmental toxin when someone is really constipated and isn't removing just normal day-to-day toxins, that's the wrong order of business. You need to get the detoxification pathways moving, and then you can start mobilizing, as in, treatments that we utilize to mobilize the mold and then catch onto the mold. They're called binders, and they literally bind the mold, but then they have to be able to pull it out of your body. And if you're not excreting regularly, you're going to make a mess of it. So there is an order of business. Same thing with SIBO, small intestinal bacterial overgrowth. There is a correct order and treatment that you have to do things, otherwise you make them worse. Okay. There are, acupuncture we do here at the clinic, or we can recommend someone for you if we think that's going to be a good treatment. And also there are some things called natural prokinetics, meaning pro meaning for kinetic, meaning movement, right? So that's what we're trying to get, right? So we're trying to get the stomach to move again, but so we have to unburden it and then help it move. And you have, as I said, you have to do all these things in the right order. But ginger is a beautiful prokinetic. So is chamomile and milk thistle and lemon balm. You know, there's a lot of different products that have those things in it. But again, you know, there is, you know, cart before the horse versus the horse in front of the cart. We need to make sure that we're doing this in the right order. That's very, very critical. So my reason for speaking to you today about gastroparesis is that it's something that can really creep up on you. You want to jump on it as quickly as possible. So I went through the 7 kind of signs and symptoms of early gastroparesis, and we want to be able to address those, as I said, as quickly as possible so it doesn't get more severe. And we do frequently see new patients that have not been diagnosed with it, but they have all the signs and symptoms. And yes, it's part of our program. It's part of how we handle acid reflux and normalize gut function and handle hiatal hernia. Everything I mentioned is part of that program. But this gastroparesis is kind of insidious and sneaky, and it really can worsen to the point that life is pretty miserable. And as I said, conventional medicine does not have a good solution at all. So the faster we can identify it, the easier it is to treat. And that's what I want for you. I want you to enjoy great gut health, so that you enjoy great longevity and overall health, and you feel great. You deserve that. So I hope you found this informative. If you did, please consider subscribing to the channel. We're trying to increase our subscribers so that more people get alerted to these videos and they learn things. And I can't tell you how often people comment on the video saying, oh my, this is me. I've been suffering for X number of years, and sometimes it's decades, sadly, and nobody's ever put this together for me. So if you enjoy the channel, subscribe, give it a thumbs up, share it with others so that more people can be helped. And I do answer all my comments, and I look forward to hearing yours, and we'll talk soon.